All right. Hello, everybody, and welcome back to the second episode of the Bring Curiosities podcast. I'm here with Dr. Claire Ashley. Is that right? It's Claire Ashley, right? I'm not
That's
butchering
correct. Yeah,
anything.
that's right.
Excellent. And we're here to talk about ADHD and burnout specifically. So you are a GP that has gone through burnout. What is your story and why are you so familiar with burnout?
Yeah, so I'll just briefly introduce myself and then I'll talk about my story. So yeah, I'm Claire Ashley. I qualified as a doctor back in 2008 and then qualified as a GP at the end of 2018. My academic background is in neuroscience, public health, and health inequalities. And I have a particular interest in burnout and mental health. I'm a very, very passionate mental health advocate. And I always have been, actually, but it really, really took a hold of me after my own particular experience with burnout, which started back in 2019. And in terms of what happened to me, I qualified as a GP at the end of 2018 and went straight from a job where I was very, very protected in terms of the workload, was with a very supportive team, into a job where the workload was it was just it was insane. It was off the charts. And because of the type of software that we were using in the surgery at the time, we were able to compare our patient demand to national averages, and we were an outlier. We were the surgery with the highest patient demand in the entire country, and I'm not exaggerating because I've seen the data. And I was expected to see 50 patients a day. I did not have protected time for anything, for my admin, for prescriptions, for doing lab results, for reading letters, for doing anything for my patients other than the absolute bare minimum, dare I say it.
50 a day, you wouldn't have a lot of time to see any of them.
No, it was almost impossible. And it took about 6 months for me to go from being totally well, completely functioning, never having had a mental health problem in my entire life, to being in a mental health crisis, not recognizing who I was, what I had become at all, having panic attacks, having no confidence, even like getting into my car to drive. I couldn't do it because I didn't have the confidence. It sounds like a weird thing to say, but I just didn't have the confidence to do it.
Yeah.
I was a wreck. I was an absolute wreck. And I ticked every single box of a mental health crisis apart from suicidal thoughts. But I think my thinking processes were so distorted. I think I was probably very close to that happening. And I basically had an experience where I had a panic attack down the phone to my husband over nothing, basically. And he really was like, what is happening? What is wrong with you? And I just suddenly had this moment of, oh my goodness, I had known that there was something wrong, but I didn't know what it was. I didn't even know it had a name. We'd never been taught about it in medical school. The word burnout didn't mean anything to me back then. All I knew that was I was in a total mess. And what followed after that was a very, very difficult period of learning to regain my old self, to put strategies in place to get myself better. Yep. It's not been a straightforward recovery. It's been very up and down.
I needed healing support. Is not a straight line. It's usually ups and downs, and
yes.
One step forward, 2 steps back, and vice versa. It can be very chaotic.
Yes, chaotic is exactly the word. So I made the decision to leave the job that burnt me out. That was actually a really hard decision, particularly being a healthcare professional where you really care about your patients and you care about doing a good job. Felt very much like a failure, and that was a very difficult decision to make. But I made that decision and I left with a plan to locum, which is kind of freelance GPing, at the end of January 2020. And then, of course, the pandemic hit, and it's just the worst time ever to go locum, because all of that work dried up, because we went overnight from seeing patients face to face to keeping them at arm's length for their own safety and for our safety. The dark days of the pandemic and that first lockdown. And I had to work full time because my husband, he works in film and TV, and that industry shut down completely.
Oh yeah, of course.
So I wasn't able to recover in the way that I should have done. But this is, we live in, no one could have predicted a pandemic. We don't live in an ideal world. Sometimes you can't do the things that you really need to do to.
Yeah, sometimes stuff happens and you have to go with it.
Stuff happens, yeah. And then I had a bit of a slide. 2021, I slid back into burnout. I got professional help. I had a doctor. I had a therapist. And then I was just.
And that helped.
Yes, very much. Yeah, that's what I needed. And I've made a lot of changes to how I work as well.
We're going to talk about all of that.
Yeah, absolutely. So yeah, it's been a bit of a long, it's been a long journey. It's been over 4 years now. But I am finally in a place where I feel like I'm much more in an even keel. I feel like the old Claire is back. I feel like I can cope with my stress much better, and it's a really lovely place to be. I understand what it feels like to be there. I understand the despair, the desperation that people feel when they're in burnout. I know what it takes to get better, and so now what I'm doing is sharing my journey on social media so that other people can learn from my journey.
All right. So, how would you define burnout? How would you define, the symptoms? How would you define what burnout looks like for people?
Yeah. So there are three components to burnout in the official definition. The first one is emotional exhaustion. So that's the fatigue of caring for too much for too long. The second part is depersonalization. So that's cynicism and apathy and feeling detached from your work in particular. Yeah, you're
Oh
nodding.
my
You know what
God.
this feels like.
It's just so many people
Yeah.
are going to relate to that,
Yeah,
especially in the neurodivergent community.
absolutely. Yes. And then the third component is reduced performance at work. And the reason why that's in the definition is because the WHO doesn't recognize burnout outside of the workplace. But as both you and I know, people who are neurodivergent are more at risk of burnout, and not necessarily because of work stress, because of the effects of their neurodivergence. But
Yeah.
also there are other populations of people like carers and parents, for instance, who don't do paid work but are very much at risk of
Oh,
burnout. So the
that's
definition
very
is
much
not.
work if you're a
Oh,
parent.
100%. Yeah, yeah.
And yeah, and when you have ADHD, you have, I think, you're 4 times more likely to be in a burnout
Yes.
than if you don't have ADHD, which is a lot.
Yeah.
4 times more. It's huge.
Mm. And the other thing to remember about that is that it's women in particular who have ADHD that have that increased risk. I think largely because women mask more and are more likely to be diagnosed later in life as well.
Yes. Yes, the late diagnosed. And I've seen a paper that said that usually women get 2.1 on average diagnosis before their ADHD is recognized. And
Mm.
usually they are diagnosed with either depression,
Yeah,
anxiety, or bipolar disorder.
yeah,
And then they get diagnosed with ADHD when it's finally recognized.
yeah, absolutely. Yeah, absolutely spot on. And that very much ties in with my own clinical experience as well. Being a GP in the UK, we manage the majority of mental health problems. And I see so many women who have been diagnosed as depressed or anxious, and actually they're neurodivergent.
Yeah, because a lot of the depression actually does come from ADHD, from
Yeah.
undiagnosed ADHD or undiagnosed autism or
Mm.
an undiagnosed just neurodivergence, because especially when you don't know what's going on,
Yeah.
you have so much lower self-esteem because you think
Yeah.
that you are the problem as
Yeah.
opposed to you have a problem,
Mm.
which is a shift in mindset that is so important when you get diagnosed.
Mm.
And so just following up, these are the main things in burnout: the emotion, the depersonalization, and reduced performance.
Mhm.
And you've talked in one of your videos, the one that went viral, about the
Mm.
5 stages of burnout. So could you just remind them a bit so that everyone
Yeah.
that is listening hopefully knows what are these 5 stages, how to
Yeah.
recognize them, and why they're important?
Mm. Yeah, so that video has now got 2.1 million views on TikTok, which is just crazy. But it's really helpful to know what the stages of burnout are, so that you can recognize them, hopefully at an earlier stage. So with my own burnout journey, I didn't know what was happening until I hit a crisis. And if you hit that crisis point, then it's years to recover, basically 1 to 3 years on average. Whereas if you recognize it earlier on, it's much quicker to recover. So the stages are, firstly, the honeymoon stage. So this is where you have lots and lots of enthusiasm and passion for your work, particularly relevant to new jobs, new roles, or undertaking new tasks or initiatives. And at this stage, there are absolutely no signs of burnout or anything being wrong, really. You're just full of enthusiasm, commitment. You get a lot of joy from your work. You feel very productive. You take on lots and lots of tasks, and you feel creative, optimistic, and full of energy. And this sounds great. However, the risk is that you end up taking on too much and you end up overworking. And if you don't kind of effectively put boundaries in place to manage that, then you might move on to the second stage, which is onset of stress. And for people that particularly for people with ADHD in particular, in this stage, quite often it looks like, as you said in your video, about hyper focusing and increased productivity, but it's very, very difficult for people with ADHD to sustain this in particular.
Yeah, you can't sprint all of the time.
Yeah, absolutely. And then the second stage is onset of stress. And this is when you start noticing that some days are more stressful than others. And in this stage, it's characterized by three main things, which is lack of time for personal needs, seeing your friends and family less, and feeling like your job is the most important thing in your life. And this is when the physical symptoms tend to start as well. So burnout comes with a whole list of physical symptoms, and it's a surprisingly physical experience, actually. So symptoms might include things like headaches, stomach pains, eating more food or eating less food. Muscular aches and pains is actually the most common physical symptom of burnout. Palpitations.
Muscular pain.
Yeah, that is the most commonly reported physical
Like
symptom of
chronic back
burnout.
pain could be a sign of
Yes.
chronic burnout.
Yeah, absolutely. Yeah.
Lord, that makes a lot of sense.
Yeah, and this comes alongside kind of the psychological problems such as difficulty focusing and concentrating, which, as we know, in ADHD is already going to be an issue.
So we kind of just double down on that.
Yeah, it's basically heightening all of those symptoms and making them worse.
Yep.
Yeah. And the third stage is chronic stress, and this is when your stress becomes more frequent and intense. And this is when your performance really starts to be affected, and your function as well. So your problem solving skills, your performance will decrease, and quite often in this stage, people start to feel like things are slipping away from them, like you don't feel like you're in control. Your productivity decreases, and you might increase with procrastinating and feeling overwhelmed. You might start to feel like you're not performing well at your job, and with this comes a lot of guilt and a sense of failure. And all of the physical and psychological symptoms that might have started in the earlier stage, they will develop further and start to feel worse. So you might find that all of those things get worse. You might find like you're starting to get ill more frequently as your stress hormones increase up. You might not be regulating your emotions as well. And obviously with ADHD, there comes emotional dysregulation with that. So that becomes even more heightened. And basically the things that
you might be on edge all the time.
More on
edge.
Yeah, exactly.
Angry, resentful, just snapping at everyone around you. If someone says hello to you and you're like, what the hell do you want?
Yeah, exactly. Yeah, this really characterizes this stage, that emotional dysregulation.
Yeah, I recognize that very much as well.
Yeah. But at this stage, quite often there's a lot of denial as well. So you might be behaving in that way, and it might be obvious to your friends or your family, but yourself, you're probably denying it. And you might be starting to use maladaptive coping strategies to try to manage how you're feeling. So
substance abuse.
Yes, absolutely. So drinking more alcohol, other substances, but also, alcohol or drugs, I would say, are kind of the most common maladaptive coping strategies that people turn to in this stage.
That's horrible.
Yeah, it's not a particularly pleasant thing to experience at all.
Yeah. I know.
Yeah, and I think the crazy thing for myself is I look back and I recognize myself in each one of these stages, but I didn't realize it until I was in full blown burnout, which is the fourth stage of burnout. So this is when you reach kind of critical exhaustion levels that make it very, very hard for you to cope with your demands at work, but also in your personal life as well. And the emotions that are associated with this stage are incredibly distressing to experience. So failure, powerlessness, despair, disillusionment, you can't see a way out of it. And this is when apathy really starts to come into play and becomes like the main emotion at this stage. So you will also find in this stage that the physical symptoms become very, very overwhelming. And in particular, it's fatigue, like disproportionate fatigue in this stage is the main physical symptom.
Yep.
And then the fifth and final stage is habitual burnout. So this is when you're unable to recover, and you find that anything that you do to try to make yourself feel better doesn't work in any way, shape, or form. And you'll find that the way that you are behaving is not just affecting your performance at work, but it's also deeply affecting your relationships and your function outside of work as well. In this stage, you probably don't enjoy anything at all. You won't be getting any joy from your hobbies. And this stage in particular is associated with clinical depression.
Yeah, that was what I was about to say. It's that this looks very similar to depression. So how do you distinguish the two usually?
It's difficult. So about 60% of people who have burnout also have a diagnosis of clinical depression or anxiety alongside it. And it's most common in that fifth stage of burnout. This is a question I get asked quite commonly, actually. So sometimes the symptoms do overlap. And I think quite often people end up being diagnosed with depression when actually what they're experiencing is burnout, because there isn't that education amongst and awareness amongst doctors of what burnout is and how to treat it. And so quite often people might end up on SSRIs, for instance, treating depression, and it doesn't work, but that's because they've got burnout. But as I said, more people than not also have depression or anxiety alongside their burnout. And so actually you might find that treating both at the same time is what needs to happen.
So how would so I have two questions. The first one is, why is the honeymoon phase in there? Because it doesn't look so bad at first, right? So most people might say it's, you're happy, you're motivated. Why is that in the phases of burnout?
Yeah, so this is a really good question. The phases of burnout come from work that was done in the 70s by a psychologist called Freudenberger. And he was the first person that documented burnout. And even though it wasn't officially recognized until 2019 by the WHO and given an entry into the ICD-10, I think it was at the time. And what he actually did was he came up with the 12 stages of burnout. And these are the things that he observed in every single person that went through it. And it all starts with that honeymoon phase where you feel great, but what you're doing is, without realizing it, is you're slipping into patterns of working and patterns of behavior that, sustained over a prolonged period of time, don't serve you well and put you at increased risk of burnout. And it's a common stage that everyone experiences. That's why it's in there.
All right. So people with ADHD would be more at risk for burnout because we're more likely to have less impulse control and just to go and to say yes to everything until it becomes too much. And then you're like, oh my God, what have I done?
Yes. Yeah. And we see this in the data because, as you said, you've got an increased risk of burnout if you have ADHD.
Four times,
so that all plays out
as much.
Yeah.
And so the following question is basically, how do all of these stages can be seen in ADHD and outside of work as well? So how would you say that they interact with ADHD? So the honeymoon phase, we just said it, the lack of impulse control, and you get more into things, you hyper focus, but that cannot be maintained because it's impossible to sprint during a marathon.
Yeah.
Basically, work is a marathon and you need to take it step by step, but people with ADHD are more into short bursts of energy, and then people expect them to function at that level of sprinting all of the time, which is just impossible for anyone involved. But how about the rest? How about the onset of stress? How about the chronic stress, apathy, all of that? How does that interact with ADHD or autism for that matter? Because I've also heard a lot about autistic burnout.
Yeah. So with ADHD, there are two key differences really to burnout as compared to people who are neurotypical. And one of them is the speed at which you cycle through these stages. So for people with ADHD, they go through these much more rapidly, and you'll typically experience multiple burnouts over a short period of time, rather than there being like a long build up towards a burnout. So that's the first thing to know about burnout and the stages, is that you'll go through these pretty quickly.
Yeah, I've experienced this. My burnouts were ups and downs, constant ups and downs. And I usually just got to a phase where I just couldn't move or do anything for 3 weeks. And then again, with the honeymoon phase, just back into it and all of that. But it was not sustainable long term. And long term, the burnout stages would be longer and longer. And the bursts of energy would be shorter and shorter, or even non-existent by the end of my PhD.
Yeah, absolutely. So there's a beautiful description there about what it feels like to experience it if you've got ADHD. And normally for people with ADHD, because it is a neurodevelopmental problem, then you'll have experienced this from an early age as well. So for people who are neurotypical, because it's largely related to prolonged stress at work, then it's not a problem that they'll have experienced previously. And the other thing to remember about these stages of burnout in people with ADHD and autism is that it's the neurodivergence that fuels these stages. So for people that are neurotypical, it's the work stress normally that fuels it. But for people who are neurodivergent, it's different. It's the neurodiversity that fuels it. And yes, work stress does have a part to play quite often, because work environments are very, very difficult for people who are neurodivergent, and they're massive sensory overwhelm and all of this sort of stuff. But it's not the driving factor. So those are the key differences. So in onset of stress, this is when people kind of experience. We've discussed, start of physical symptoms, and feeling like your job is the most important thing of your life, seeing your friends and family less, lack of time for personal needs. I mean, I would say for people who are neurodivergent, particularly with ADHD, I mean, this is probably where the kind of the emotional dysregulation is going to be worse, and probably where everything that happened in the honeymoon phase, such as that cycle of hyperfixating and being very, very productive, you'll probably find that that's starting to have a little bit more impact, I guess, on how you live and how you work.
It gets boring.
Yeah.
We get bored,
Yeah.
and when we get bored, it becomes impossible to start doing a task because of the lack of executive functions, right?
Mm-hmm.
The anterior cingulate cortex that is smaller
Yeah.
in people with ADHD doesn't work as well.
Yeah. I remember you saying in one of our previous conversations that you're more likely to get fired if you've got ADHD as well.
Yeah,
And
you
I
are.
think that this is a stage where perhaps it would be more obvious to your work colleagues and to your manager and to your boss that you are struggling, compared to people who are neurotypical, which I'd say is probably the third stage where it starts to look more obvious. I don't know if you agree though, Ludo, with
I
that
think, yeah,
assessment. Yeah.
maybe during the chronic stress phase or the
Yeah.
apathy phase, during those two phases, I've had
Mm.
comments from my supervisor about my work, because
Yeah.
it was just impossible to anything. I would snap or answer back about
Mm.
anything he would tell me. He was like, could you do that task? I was like, no. No reason, just no, because it was too
Yeah.
much, because everything felt too much.
Mm.
And so this is where the performance definitely starts to go down.
Yeah.
And people notice.
Yeah.
People end up noticing.
Yeah, like you said, it's that emotional dysregulation, particularly comes to play in the chronic stress side of things, which is already something that people with ADHD will have problems with and difficulty with, but it becomes very, very pronounced in that stage.
Yeah, you might snap back to your boss, and that's something that
Yeah.
maybe it goes unnoticed once or twice, but then after a while they'll be like, "Look, you're fired because that's too much."
Yeah.
And if you have ADHD, it's already hard to control your emotions just in general. But if your constant dominant emotion is stress and anger and resentment, then it just becomes impossible.
Yeah, absolutely. I think in terms of like the burnout stage and the habitual burnout stage, I mean, I think at that point you're at a point where your symptoms, all of the symptoms are heightened, and you're at the point where perhaps your previous coping strategies are not working, basically. And I think it's similar to kind of neurotypical burnout in that stage, in that you probably need a lot of support, therefore, to start to get on top of things.
So there's also evidence that ADHD medication does help
Yeah.
with burnout, or at least with making it easier to manage,
Mm.
as easy as managing a burnout can be. I've also another question for you, which is, you talked about this in your recent video about ADHD burnout and autistic burnout. How is burnout different for people that have autism or ADHD? How does does it have different symptoms, basically?
Yeah, so in people who are autistic, again, it's the autism that is fueling the burnout, but it is a slightly different experience. So exhaustion is probably the main symptom for people who are autistic, that emotional exhaustion, particularly I think because, autism is a social communication, that's where the majority of the difficulties is.
Yep.
Where it lies. And I think that largely is what drives that exhaustion, regardless of whether or not you're experiencing the autistic burnout at work or elsewhere, because it's exhausting to constantly have to mask. Yeah, exactly. To constantly have to deal with that.
So it's the masking that can drive a burnout in people with autism and ADHD.
Yes, absolutely.
More than work or workload.
Yeah. Yeah.
It's just
huge.
Existing in a social space.
Yes. Yeah. Existing in a neurotypical world is exhausting for people who are neurodivergent, and really that's what fuels it.
Can relate.
Yeah. The other thing that's really a key component of autistic burnout is increased overwhelm. So finding it difficult to manage those sensory experiences that perhaps when you're feeling well, you've got strategies in place to try to manage them. But basically having a lower threshold for feeling massively overwhelmed and not being able to control your emotions. So again, it's that emotional dysregulation part as well. But yeah, so quite often people who are autistic, they find it very difficult to, they might have sensory, they might not like the sensation of clothes on their skin or tags in particular. They might find loud noises really overwhelming. All of that gets really heightened in autistic burnout.
Yep.
Those are the key features. They don't get quite, the hyper focus and productivity. It's not quite the same for people who are
It's
autistic.
not quite the same. There's different pattern recognition mechanisms that are going on. I mean, each neurotype is different, although ADHD and autism are quite linked. So there's definitely some overlapping traits.
Yes.
So moving on, one of the questions that I most had when I started tackling this subject, because a lot of people have asked me, how do you recover from burnout? How do you manage burnout? When you're in that phase where you don't want to do anything anymore, or you're in that apathy phase where you just don't care about anything anymore, how do you get out of that? Because to take steps to get better, you need energy, but energy is precisely the thing that you're lacking when you're in a burnout.
Yeah.
So how do you get out of it? What are your advice? What's your advice regarding that?
So there are 6 stages to burnout recovery. The first one is recognizing that you're in a crisis, which is surprisingly hard to do. And that's why it's stage 1. The second one is distancing yourself from work. So this is for neurotypical burnout, by the way. So you have to distance yourself physically, mentally from the source of your stress. Now, if you are neurodivergent, that's very difficult / impossible to do. Because
life is stressful, that's difficult.
You can't take a break from your life. So actually, I will come back to that, and we can talk about some strategies about how people who have ADHD can manage that. But yeah, in an ideal world, if you can remove yourself from the source of your stress, so there is potentially, if you have ADHD and you're finding it very difficult to function at work because of burnout, then having some time off sick could be something that allows you to at least have some space and recover some of your energy to focus on your recovery.
I'm going to come back to that as well. It's part of the questions that have been asked, but please go on.
The third stage is restoration of health. And what you need to do in the early stages, because fatigue is an overwhelm of such huge components of it, is to allow yourself to physically rest. Now, this is very, very difficult to do, particularly for people with ADHD, because there's a lot of hyperactivity and impulsivity, which can make it very difficult to stay still and to relax. But ideally, it's about basically doing low-cost activities if you can. So things that don't require a huge energy spend. So sleeping, napping, playing on your phone, using a fidget toy, whatever it is, until you start to feel like you have a little bit more energy. And then the things that the data tells us in burnout recovery that help are socializing. Interestingly, that I think that can be tricky actually if you're neurodivergent.
It can be very tricky because a lot of social interactions are actually exhausting.
Yes.
So it's very, very difficult to recover energy from these social interactions. Usually when I'm out, even with friends, I'm having an amazing time. But when I'm home, I'm very happy to be home.
Yes. Yeah, exactly. And then it's like physical activity. So getting back into doing some movement. And then basically, as you start to gain your energy back, you can start to do a little bit more. But just the key in this stage is not to do too much too soon, because you'll find that the fatigue and the exhaustion comes back with a vengeance. Then the fourth stage is visiting your values and doing some work on that, because your post-burnout values will be different to your pre-burnout values. 5 is exploring your options, so working out what your options are for moving forward. And then stage 6 is making a change. So largely with neurotypical burnout, that features on changes at work. But with neurodivergence, I would say that needs to really focus on how you are managing your ADHD or your autism or whatever neurodiversity that you have, so that you can reduce its impact on your stress levels, basically. So talking about people who have ADHD in particular, quite a lot of those stages are going to be difficult for people who have ADHD.
Yeah, and I was going to say not only for people with ADHD, like distancing yourself from stress or from work, especially in my comments when I did the video as well. A lot of people from the US in particular say that, taking time off is not an option because you don't have paid leave, and 67% of Americans live paycheck to paycheck.
Yeah.
So distancing yourself from your source of stress when your source of stress is what allows you to survive is very, very difficult.
Yes. The good news, though, is that in the literature, it tells us that people get better from burnout even if they don't take time off work. So I think
That's good news.
it is good news. And actually, people get better even if they don't make any changes. But it does mean that you're more likely to slide, and it is harder. So in an ideal world, yes, you take some time off work. For a lot of people, this isn't an option. I don't know if it's good news to people when they're in that situation, because I know what it feels like to be there, and I'm not sure if someone had said it's okay if you don't take time off work. I think I would have been quite angry about that, to be honest. But this is what the data tells us: most people do get better even
I
without
think it's
that.
reassuring if it's not an option. If it's not an option,
Yeah.
at least you don't have to tell yourself, well, I'm condemned to be in this state forever and ever because I just can't stop working, right?
Yeah, exactly.
But definitely a holiday is what helped me the most.
Yes, and actually that's a really good point. So when it comes to burnout, having regular short breaks in terms of your holidays, but also in terms of your working day as well, is much more effective when it comes to burnout prevention and recovery than waiting for like one long break every day or one long summer holiday, for instance.
Yeah.
But yeah, coming back to people with ADHD, to break the burnout cycle really, and to move yourself through recovery, it's about tackling the symptoms and your neurodivergence and minimizing the effects on your life. That's the real key to kind of breaking those burnout cycles, I would say. You mentioned medication. So medication can be very effective at helping people with ADHD to learn how to break those cycles, because it improves all of the symptoms, particularly, concentration, focus, all of that sort
Therapy
of
as
stuff.
well.
Therapy, yeah. So therapy, CBT, DBT are evidence-based. And I think, I do think that making changes at work can be really helpful. In
Having
the
accommodations.
yeah, reasonable adjustments, having accommodations, particularly because even if that's not what is driving your burnout, work will be a source of stress, and
Yep.
having adjustments made will be really helpful. And in the UK, you can get funding for this through the government, through their access to work scheme.
That is amazing.
Yeah,
I didn't know that.
yeah, it's great. So take
That's going
advantage.
to be
And
helpful for a
actually,
lot of people.
the other thing is, you don't even have to be diagnosed. If you're on a waiting list, you can still get support through the scheme.
Okay. That's really great.
Yeah.
That's really, really great. This is definitely something that will help a lot of people.
Yeah.
For the steps that you mentioned about the recovery, and that you said they might be harder for people with ADHD, I feel that actually the recognition one might be a bit easier, because when you're diagnosed with ADHD, you're already kind of used to monitor your mental health and how you feel. And so a lot of people with ADHD do recognize that they're in a burnout. They just don't know how to get out of it. Because as you said, distancing yourself from stress when it's life that stresses you, it's a bit harder. The restoration of health with the hyperactivity, a bit harder. Socialization a bit harder. Physical activity, that might be good, but we do struggle with routines. However, it helped me a lot to start physical activity, so that's definitely a plus. And then you said revisiting your values. So how would that look like for neurotypicals, and how could it look like for people with ADHD or autism?
I think it broadly would look similar, actually. So your values are basically the principles that are really, really important to you. They're the things that the principles by which you want to live your life by, and the things that give you the most joy and the most meaning. Burnout, like any major life event, like a bereavement, a serious illness, the birth of a child, for instance, those events cause you to reevaluate what's important to you. And what the data tells us is that in burnout, people's values change. So the reason why it's an important stage of recovery is because if you continue to make decisions based on your old values, you're not going to make decisions for your future self that are going to be helpful. And if you get it wrong, you might then feel more burnout cycles. And this is a mistake I made the first time around with my first burnout, is I continued to make decisions based on my old values, which were largely to do with duty and service, being a healthcare professional. Whereas now I would say I value advocacy, for instance, more than those things. And my health. Health is the common feature, actually, for everyone that goes through burnout. They prioritize their health more than their pre-burnout lives. and family life. Like, I want to spend time with my family. I don't want to be
Yeah,
slaving away at work the whole time. I want to see my kids grow up, and be the best mum that
definitely.
I can be, because I was definitely not the best mum, or at least I wasn't the mother that I wanted to be during the burnout period. Those are the things that drive me. And every time I make a decision, whether it's to do with my life or to do with my work, I go back to those values and I think, is what I'm doing in alignment with those values? And it's actually a really great thing to do, because if you've got a difficult decision and you're like, oh, I'm not quite sure which option to go for, they're both great, or that you've got several options and they're all good, go back to your values and it will tell you which one is the best option for you. And so I think that this is equally applicable to people who have ADHD as well as people that are neurotypical. I don't know what your thoughts are about that, Ludo, but
Well,
yeah.
I think that I completely agree with this,
Mm.
because your old values are also what brought you to burnout in the first
Yes.
place.
Yeah.
So with your old values, let's say you have old patterns, and so if you have your old values and you stick by them, you're going to repeat the old patterns, and so you're going to get back to the point where you were, which is
Yeah,
burnout. So you
exactly.
have to change values to change
Mm.
patterns. So that is absolutely something that needs to be done.
Mm.
Something that I maybe was wondering about the values and stuff is also, one of the predictors I saw when I started studying all of this and I started going into the literature of burnout, is that one of the main predictors of burnout is, toxic work environment, of
Mm.
course. So when you're berated or you have people that treat you badly at work, then that increases thousandfold your stress. But
Mm.
also the difference between what is requested of you and how much you're rewarded,
Yes.
which in most cases is economic reward, so how much you're
Mm-hmm.
paid. It's basically, I just had a small thought that was, burnout is basically a syndrome of, I'm not paid enough for this crap. And it's very reductive, but I
Mm.
find it very interesting that it's the second highest predictor of burnout, that people are just not paid enough for their jobs.
Yeah.
And I found that this was very much the case for me, because I was doing a PhD,
Mhm.
and as many people know, PhDs are not paid very well. You barely get by, and it was very difficult for me to justify, even rationally, doing an insane amount of work, the papers and the reviews and the editing and the hours spent. I was having weeks where I would work 50 to 60 hours a week nonstop, for such a bad pay,
Yeah.
for such a bad quality of life. And I kind of, when I switched jobs and now I have a new job that pays me a lot more, for more or less, maybe not the same amount of work, maybe a bit less amount of work, but I find it a lot easier to justify doing that amount of work.
Mm.
And for my partner, it was the same. Just having a higher pay changed completely her view to work and to workplace stress.
Mm.
And so
Yeah.
that I feel is also very linked to our current economical situation, which is not only about neurodivergence, about the
Mhm.
recognition of all of that, but also about how things are going into the world right now. And so not
Mm.
only neurodivergent people, but everyone is more at risk for burnout right now, which is also what the data shows.
Yeah.
So this is a very pretty big parenthesis and tangent. But uh, this
I
is
would.
also what I think about the values. So how do
Yeah.
you think you could adjust values to go more in that direction and to avoid
Mm.
going back into, either toxic workplaces or being in a job that just doesn't pay you enough for
Yeah.
what you're doing? Because I was getting to a point with all of that.
Yeah. What I would say about reward is, yes, at the end of the day, your paycheck, it does matter. And that sense of reward, if you feel rewarded by your work, then that protects you against burnout. And if you don't feel like you're rewarded, then that is a very, very strong risk factor for it. So obviously at the moment, the cost of living crisis and certainly in the UK, inflation for the past year has been off the scale. And so everything has been getting more expensive. And what that does is it means that your paycheck doesn't go as far as it used to. And it for a lot of people, times are tough right now.
Yeah, your quality of
And
life decreases and you're doing the
exactly,
same work
yes,
for
yes, yeah.
less and less.
But at the same time, actually, your work demands are probably going up because your work will also be affected by all the increased bills and the cost of living crisis. And so they'll be asking you to perform, to do more with less, basically. And that also is very, very stressful. What I would say about reward is you don't it doesn't, when it comes to burnout, it doesn't necessarily have to be financial reward, although it does play a huge part in burnout risk. But you can get reward from other things than purely finances. So it can be as simple as, you have a good relationship with your boss and they look
Yeah,
out for you, and they might say to you, oh, I've noticed that you're really good at doing XYZ. I'd like to put you forward for a promotion, or would you like to go on a course to improve your skills in this, and you can take on a new role. Like, that's really rewarding when people recognize you for what you are and try to bring you on. But also, on an individual level, doing work that is personally meaningful reduces your burnout risk by 50%. And you
yep,
only have to spend 20% of your time doing work that is personally meaningful and getting that reward to get that
20%.
20%. Yeah.
So could it be
Yeah.
just a hobby, for example?
Could be. Yeah. Could be.
That's amazing.
Yeah. So 20%, if you're working 5 days a week, that's 1 day a week doing something that you really love. That's enough to give you that buffer when it comes to burnout risk.
That's that's impressive.
It is.
That's
Yeah.
impressive.
Yeah.
And so for making a change, which is the last step that you mentioned for recovery,
Mhm.
how can you do that considering that you still have to pay the bills and to live and to pay rent and all of that? Because that's
Yeah.
realistically, because of course
Yeah.
this is the ideal scenario, making a change, but how
Yeah.
would you realistically go about doing that? And then the added question is, especially when you have ADHD or you're neurodivergent.
Yeah, absolutely. So talking there about meaningful work, one way that you can, if you feel like you are not in a financial position to leave the role that you currently have, is you can look at what your job is and what your role is and what your tasks are and what your job description is, and see if you can make some tweaks. So there's this thing called job crafting, which is where you look at what your resources are and then you kind of tweak things to allow and use the skills that you have and the people around you to allow you to do slightly more meaningful work. And there are different ways you can do this. You can do this by trying to increase up your physical resources. You can do this by using the people around you. So that's your relationships. And you can also do it by how you change your mindset and how you change how you view your work. I think for people that are burnt out, this can feel quite difficult to do.
Yeah, because you have
And
no energy.
exactly, yes. And I also worry with job crafting that it might be used as by employers as an excuse to wash their hands of, like, kind of trying to counter burnout culture at work and try to
Yeah.
don't take responsibility for toxic workplace cultures. And 100% they have to do that, because job crafting is an employee initiated approach. So I worry a bit about that, and I worry a bit about exploitation as well. But job crafting does allow you to kind of tweak things ever so slightly so that you can start to do more of what you enjoy and then get more meaning out of your work. So that can be really helpful to do. The other thing I'd say is yes, if you're stuck in a job at the moment and you can't move because of financial pressures, accepting that at this particular point in time doesn't mean that you can't make a plan to try to move out of it. And you always have choices, even if it feels like your choices are limited. You do always have choices. You can always make a plan. And I think sometimes just that switch in mindset, knowing that you have some choices available to you, is enough to make you feel better. Because the people that have that switch in mindset, this is one of the predictors of successful recovery, actually, is that switch to knowing that you're in control of your own well-being. Really, really key to burnout recovery. Because what happens is your behavior changes as a result of that mindset shift, and that you're more likely to go and actively make the changes that you need. Whereas if you stay in that mindset of feeling like you don't have control, you'll continue to make the same choices and you'll end up being stuck in the same job and feeling the same way. So yeah, and it's hard to do that. It's really difficult to do it. But when you have that revelation that you're in control, you can do anything, and it really makes a big difference to your recovery.
So, one of the things about the making a plan part that can be more difficult for people that are ADHD or autism, is that usually people with ADHD, statistically, they are less educated in terms of diplomas or
Yeah.
school diplomas, of college and all of that, because it's more difficult having a higher education, and also because statistically they come from a lower socioeconomic status families that can't necessarily afford studies. or high degree studies. And so for people like those, options and making plans might be something that is more limited. And similarly with autism, about 85% of people that have autism are unemployed or searching for a job, or are, on sick leave because they just cannot cope with all of that. So it's very, very difficult to make a change where you already are at a disadvantage in some ways. So when talking about this kind of population specifically, what kind of plans could you be doing if you're stuck in a job that you don't like and that it's burning you out?
I think, as you say, you're already more likely to be at a socioeconomic disadvantage, an educational disadvantage. I think it's about playing to your strengths and starting with very small, achievable changes. And also being kind to yourself, and recognizing that actually it might take you longer to get to where you want to be because of your neurodiversity. And yeah, it's not fair. It's not fair. And it will be a harder journey for you. This is why people with neurodivergence, they cycle around burnout rapidly, and it's very difficult to break out of those cycles because it is fundamentally harder for people to do that. But I think it's about being very realistic about what it is that you can do and achieve. Because if you set yourself too high a goal and you can't achieve it, then you're just going to get really deflated and not want to kind of carry on making those changes. And the other thing I say is get support if you can. So get support from your doctor, get support from an ADHD coach or a therapist that has a specialist training in ADHD, or whatever it is. Like, make sure that you have someone there guiding you through it, because quite often, especially for people who are neurodivergent, like, you might have coping strategies, but actually having that accountability, if you can access it, I know it's hard sometimes to do that, but if you can access it, they can keep you on track. So also, if you can't pay for it yourself, or if you can't access it through like a government scheme like we have in the UK, then peer support might be the way of doing that.
Yeah, that's also the difficult part with the socializing and so on.
Yeah.
But yeah, I mean, I think one very important thing that you mentioned is the forgiveness, is the acceptance, is, forgiving yourself and recognizing that your difficulties are not your fault. That you have difficulties because your brain is wired in a certain way, and accepting that you might not be able to change as fast or as well as other people might do in the same time frame, but that eventually it's still something that is accessible to you. You just have to take it step by step.
Yeah.
And a sentence that I heard that is really amazing is that don't judge yourself by your best days. Try to take into consideration that you also have bad days, and try to, judge yourself by either your worst days or by the average, and see what is possible with that level of energy, and let go of the things that you can't control. Something that helped me a lot, in particular with my burnout, is to just stop obsessing over all the things that I wanted to do but couldn't. And at some point, if my house was a mess, then my house was a mess, and that was it. Because if every day I just repeated to myself, you have to clean the house, you have to clean the house, but I never got around to do it. And so I felt bad about myself. I felt guilty. I had even less energy because I kept being stuck in a negative self-pitying cycle. And when I just accepted that it was not going to be done because my brain was different, then something changed. And somehow I had a lot more energy, because it was an energy that I was spending in feeling guilty and feeling ashamed for not being able to do this kind of stuff. So yeah, being kind and being accepting of your limitations is definitely something that is extremely, extremely important that you mentioned.
Yeah. Just on that note, think of all the time and the energy that you've wasted, and I've done this as well, beating yourself up. It's wasted energy. It doesn't get you on. It doesn't move you on. There's nothing positive about that experience, and it's difficult to break that cycle.
How do you do that?
Yeah, I knew this question was coming. So I think for me, learning to challenge those thoughts of those high expectations was really fundamental. So tackling my underlying perfectionist traits and my imposter syndrome, and dare I say it, my Catholic upbringing, because we do guilt really well. It was therapy. So I did a combination of CBT and acceptance and commitment therapy. So CBT, whenever I got those thoughts when I was beating myself up, when I was like, you're useless, you're a waste of space, what's wrong with you, why can't you cope, all of this sort of stuff, What I do is I do a process where I capture that thought, and I'd mentally, or sometimes I'd write it down actually, at least to start with, I'd write it down. You ask yourself, what is the evidence for this thought? What is the evidence against this thought? And then you write an alternative thought, and that's the thought that you then say back to yourself. And it's very, very effective. You have to practice it. You have to do it regularly to really notice the benefits. And with time, it becomes more automatic. Like, to start with, you have to go through that, consciously go through those stepwise processes. But with time, you'll find that it becomes a lot easier, and it really does help you switch from that negativity bias to a more positive bias. As humans, we're wired for negativity bias, right? That's what we fixate on, all the stuff that's gone wrong, all of the days where you haven't performed your best. We can't help that. That's true of everyone. But CBT really helps with that. And with acceptance and commitment therapy, the exercise that helped me the most was this thing called diffusion. It's different to CBT. You don't try to change your thoughts. What you do is you just learn to sit with them and not have it affect how you then go and behave. So, for instance, if I was having thoughts of, I'm just not good enough. That was a very recurring thing for me actually during my burnout. You're not good enough. What you do is you just sit there and you repeat the thought in your head, and then you say to yourself, I'm noticing that I'm feeling that I'm not good enough. And then you sit there and repeat that in your head. And then you say to yourself, I am observing that I am noticing that I am thinking this thought. And you do that over and over. And you're not changing the thought, but what you're doing is you're just making space for it. And it's a really effective technique. But again, you have to practice it. And actually, that was the number one technique that helped me to manage all of that guilt and to learn self-compassion skills.
I was about to say this one might work a lot better for people with ADHD and autism, because for CBT, for example, the thing is that a lot of people under my comments when I suggested CBT said that it felt like gaslighting your own emotions.
Oh, that's interesting. Yeah.
Also because, people with ADHD, I think it was a GP or a professor that said that they receive on average 20,000 more negative comments by the time they're 12 than their peers.
Wow.
So when you have that negative self-talk and that negative self-image, it's a lot easier to just rationalize those thoughts from something that you've heard other people say to you. So it's a lot harder to say this is not a rational thought, because it is in fact a very rational thought for a lot of people that have ADHD and autism, because when you're telling to yourself you're not good enough, and a therapist or whoever tells you, what is your evidence for this? You're like, well, I've been told this by my parents, by my teacher, by my peers, by my friends, and you have a whole list going on. So fortunately, as a personal example, my parents weren't like this, but my teachers were. So I have a lot of examples throughout my life of people telling me that I wasn't good enough. And at this point, CBT is not going to be very helpful, for example, because it just feels like I have to ignore these experiences that very much happened in there, that are an ongoing part of life of everyone that has ADHD and autism, I think. So CBT has been very much criticized for this. Because it really didn't help with emotional stuff for people with autism and ADHD. So the diffusion thing, on the other hand, that is something that I have tried, and that has also really, really helped. Just listening to yourself and accepting those emotions for what they are, and just, keep doing your thing and keep trying. Because even though people might say these things, eventually, it will create feelings, but it's okay to have these feelings, and it's okay to sit with them, and it's okay to keep going.
Yeah. Actually, I love acceptance and commitment therapy so much. I actually went and trained in it. So I trained earlier this year because I think in burnout in particular, it is so transformative. And particularly, as you say, for people with ADHD, there's a large component of acceptance and commitment therapy that kind of, all of the techniques get you to learn that what you're experiencing shouldn't come with judgment or labels, and that psychological suffering is normal and it's part of the human experience. And what's really interesting is they don't label emotions or thoughts or behaviors as good or bad or negative. And so for someone like yourself, as you said, by the age of 12, then you might have 20,000 negative comments said to yourself because of your neurodiversity. It removes that negativity from the situation. So I think it's a really great form of therapy. For me, it was transformative.
All right. So you said acceptance and commitment therapy.
Yes, there's a book, an amazing
Amazing.
book called The Happiness Trap. I'm just trying to see if I've got it here. I think it must be on my bookshelf. I can see
That's
it.
fine.
It's The Happiness Trap by Russ Harris. It's quite a long book. If you've got ADHD, it might be difficult to sit down and read it in one go. But you can. The great thing about acceptance and commitment therapy is it's got 6 main parts to it, but it's not a sequential form of therapy, so you can dip in and out of the different parts as you see fit. So you can just pick a chapter that feels like the one that you need the most, and just have a look at that, and maybe do like 1 or 2 exercises from each chapter. I think
if
it
you
would
want, you
be.
can send me the title
I
afterwards,
will.
and I'll put it in the
Yeah.
resources
Yeah.
under the YouTube videos and the Spotify description.
I recommend this book so much. I think Russ should give me some sort of commission.
And I've had a question when I said that I was going to do a podcast episode with you that was, do you ever go back to normal when you recover from burnout?
This is a really interesting question. And the data is varied. Largely it says yes, you can get back to normal, whatever normal is. I would say actually that's a good question. What is normal? I think in this context, it's about getting back to your pre-morbid baseline, whatever that is for yourself.
Okay.
And but I would have said a year ago, no, I don't think so. But I have now gone through the recovery process, and I am in a place where I feel like I am able to manage stress in the way that I used to. I have gone back to my baseline function, and it feels really, really good. What I would say is, so yes, the data tells us, and from my own personal experience, yes, you can get back to whatever your baseline is. However, you can only do that with sustained changes. And that means that I constantly have to work on myself. I constantly have to practice the therapy techniques that I've learned. Every decision I make, I go back to my values, and I go back to respecting my burnout. I know, for instance, if I go and do a GP shift, the next day I am on the sofa and I am wiped out. The fatigue is real. It's the nature of the work. My startup, I have a startup now. I've been working on it full time since the summer. I don't get that. It's really interesting. And I never thought that I could. At one point, I was like, I can never go back to working full time. This is just me. This is how it is. But I can do
And then
it.
you can.
But that's because of the changes I've made, and it's the nature of the work that I'm doing. So, I know that if I go back, if I went into full-time medical work again, that I would just end up burning out. So, yes, I've recovered, but I can only sustain that with ongoing changes and continuing to practice the things that allowed me to recover. So the answer is yes, I think you can get back to baseline. The data agrees with this as well. However, you can't go back to where you were, engage in the same behaviors, be in the same environments, and expect things to last. If you go back into the fire, you'll burn out again.
So I have another question about this, is that, as you mentioned, burnout usually starts earlier for people with ADHD or neurodivergent people. And I've had a lot of people telling me that it started when they were in their teens, right? You start being burned out when you're 11 or 12 because life is just so overwhelming when you have autism or ADHD, especially undiagnosed. So how do you know getting out of burnout? How do you know where you're in a place that can be maintained when all you've ever known was this level of stress?
Yeah, I think it's
really hard questions.
That is
I'm
a hard
sorry.
question. Yeah, no. I think it's about being in a place where you feel confident that you have the strategies to manage your stress and overwhelm and to prevent yourself from sliding. When you're in a place where you have early recognition of the fact that you are starting to slide again, and you can implement those strategies and allow yourself to get better, and where your function and your performance, both at work and in your life as well, is at a level that you feel comfortable with and feel happy with. And you're right, it's difficult if you've experienced multiple burnouts since you were a child and that's all you remember. You probably don't have an idea of what your baseline is, and therefore I think you just have to go on how you are functioning and how you feel internally, with the recognition that there will be some days that are worse than others. This is normal life. But mostly, I think when you're on an even keel, and you're able to cope with the stressors. Yeah.
It's also hard to rationalize the fact that you can function without that level of stress, because for most people with ADHD, for example, the stress of the deadlines, for example, was and is what makes us able to function in the first place. So it's, life without stress is very hard to picture when
Yeah.
it's the only thing that kept you going.
Yeah, that's a really interesting take on it, actually.
I'm figuring that out at the moment. It's really weird.
Yeah, I bet.
And it's really hard to not get back into that when you can't manage to motivate yourself, because the internal motivation in ADHD is very much a hard thing to achieve.
I think that's a really good point, and I think it does go back to that fundamental driver of the burnout cycle in ADHD, which is the underlying neurodivergence, isn't it? And so therefore it's going to be an ongoing challenge, and it's not going to be easy. It will be harder for people who are neurodivergent to manage burnout cycles and to break them, but you can definitely get things in place to allow you to feel like you're a little bit more in control of it, for sure.
All right. So before we, wrap these things up, I have a last question, which was also asked by people on Instagram, which is, do you advise to treat depression or burnout before you address ADHD, or the other way around?
I would
Because
say
often the burnout is caused by ADHD, so it's
yes, exactly. Yeah, so it's a chicken and egg situation, isn't it? Which came first? I think I would say it's very much down to the individual case and what their own preferences for treatment are, what the main driving factor of the burnout is, and how significant the symptoms of depression are. So this isn't a get out answer. I think this is very much down to what the individual circumstances, and it needs to be a discussion between the person and their doctor, basically. And just going back to what we said earlier about women who are largely diagnosed later in life with ADHD, quite often they are previously diagnosed with depression and are treated for that.
and it doesn't work.
And it doesn't work, exactly. So I would say my personal inclination would be, as a doctor, my advice would probably be treat the ADHD, because then you are treating the underlying cause of the burnout cycles. However, I would also caveat that by saying that if someone's depression scores are anything from moderate to severe upwards, if their depressive symptoms are having a significant impact on their life and their function and their performance, if there were any suggestions of thoughts of self-harm, suicide, anything like that, then absolutely I would treat the depression alongside it. But I wouldn't necessarily do one. Yeah, I wouldn't necessarily treat one first unless it was before the other. Yeah.
All right. Okay. So we've gone through a whole hour here, so I think we can wrap this up. We have talked about ADHD and burnout, about the 5 stages, about recovery, and about what it means also for people that are neurodivergent with autism or with ADHD. So thank you so much for being here and for this conversation that has been enlightening in just so many ways, where I think a lot of people will relate to. So if people want to know more about you, or want to contact you, or want to see more of your content, where can they go and look you up?
Yeah, so my handle is at Dr. Claire Ashley, both on Instagram and TikTok, which are the platforms that I'm most active on. And my website is www.bobby-chat.com. So Bobby Chat is my startup. It's an AI that lives in WhatsApp and helps you to manage your workplace stress more effectively.
That's amazing. That's beautiful. Thank you so much. And to everyone that is listening, thank you for listening, and we hope to see you on the next episode.
Thank you.